Welcome to this talk. We're talking to Professor Sherif Sultan. Now, Professor Sultan is a doctor, a research doctor, an author, supervises many PhD students, is Professor of Vascular and Endovascular Surgery, National University of Ireland, and Chief of Vascular Surgery and Endothelial Vascular Surgery at the Galway Clinic. And I know you've been doing vascular surgery this morning, Professor, so thank you for making time to come on to the talk.
Thanks so much, John, and it's a privilege to be on your highly esteemed channel, and I've tried to be as scientific as I can so that nobody could claim otherwise. We are living in a very, very challenging times, and there's a lot of misled public information around us, and everybody go and look whether it's truth or it's just false and all of that stuff. So what I'm trying to show you today is scientific evidence about what's going on and unveiling the truth, the critical examination of booster vaccination effect on public health and the power of artificial intelligence, because everything around us, if analyzed in a different way, will give you a completely different results. So as you are aware that I was working during the COVID, I used to put on this hazmat suit, go in a patient without any vaccination, without having anything apart from that protection. And when the patient used to go to theater for emergency surgery, everybody have to go out because they know that any droplet and you catch COVID, you're a death sentence. So I was there. I was so happy when they told us that the COVID vaccination is available. I was volunteering to go on one of the first people to get this because we saw it is like the polio vaccination. We saw this like the diphtheria vaccination. We saw this like the smallpox vaccination. You just take it and you'll never have the problem again. And we were so naive because nobody told us what was happening behind the scenes and how the government was able to sell us that COVID vaccination without telling us the other side of midnight, which is a problem because if you have a complication when you operate on a patient, you have to say open disclosure. Our government have failed us for open disclosures. They have signed a big contract with the multinational so that they cannot sue a single government for the next 75 years. In order to do that, definitely there was something happening that we were not aware of. However, again, I was for vaccination. Up to this moment, you have to vaccinate people against polio. You have to vaccinate people against TB. You have to vaccinate people against diphtheria. Tetanus once for life, you have to do that. So I am for vaccination, but the technology that have been given for the COVID is a challenging one that we need to open our mind about what's going on. And I was there. I was in the middle of this storm. I published on that. So we went on and we started looking at recurring pattern machine matching human cognitive capacity using a general AI. We are putting and bidding with the EU to get huge money to use a quantum computer in order to use a super AI, but unfortunately up to this moment we did not achieve that milestone. Hopefully over the next 2 years we'll do that. However, what I'm going to show you now is analysis using the general artificial intelligence that's available to everybody to see. That was my first publication during our shutdown in 2020. During COVID-19, government struggled with managing pandemic effectively, often failing to apply basic scientific evidence and restoring to ineffective measures such as total lockdown. In Sweden, there was no lockdown and they have the best outcome. Guess why? Understanding pathogenesis, epidemiology, and outcome of COVID-19 related thrombotic events is crucial for risk stratification and determining optimal anti-thrombotic therapy during active infection and recovery. Remember, they used to use lice treatment, anti-malaria treatment, something that's not proven to treat COVID. Desaturation due to compromised oxygen transport in blood led to multi-organ failure and high mortality, emphasizing severity of cytokine storm on COVID-19 patients. And it's very important to understand this because it builds on how the booster vaccination create havoc. Management protocol for acute respiratory distress syndrome isn't suitable for COVID-19 patients, and we learned the hard way when a lot of patients have taken the COVID-19 infection and applying the ARDS, necessitating tailored approaches to treatment. Then this Publication came in July 2022, autopsy-based histological characterization of myocarditis after the vaccination. And if you look at it, the COVID-19 vaccines in 2021, mortality was 21. All other vaccines was 526. If you look in 2022, is 9,000, and all other vaccine is 368. And this is from the UK Office for National Statistics, is not my own, it's you from England. 10 more deaths than expected since April 2022. And this was published, and nobody even commented on that. 5% of vaccines require medical treatment due to side effect. There's 3 million Germans received medical treatment for side effect because of the vaccination. Growing body of evidence indicating serious risk associated with these vaccines, urging caution in the recommendation administration. We're talking about the COVID-19 vaccination. We are talking about the mRNA vaccination, to be very clear. Reluctance to recommend COVID-19 vaccination, including boosters, to anyone due to perceived uncertainty and potential dangers associated with their use. And by the way, it's published everywhere, but nobody's talking about it. Why? Because we don't have the marketing machine of the like of AstraZeneca, Pfizer, Moderna, Johnson & Johnson. Warning against complacency and emphasizing need for a more cautious approach to vaccination efforts. Then, circulating spike protein detected in post-COVID-19 mRNA vaccine myocarditis. And everybody look, how could I get out of my spike protein? The spike protein will be washed out of your body within 4 to 6 months. So do not try to go into this chelating agent and paying a lot of money for something will be dumped out of your body very shortly. There's other problem behind the scene that you need to understand. Adolescents and young adults who develop myocarditis after severe respiratory syndrome and SARS-CoV-2 mRNA vaccination display persistently elevated circulating level of full-length spike protein unbound by antibodies. However, within 6 to 12 months, they're totally washed out of the body. Autoantibody production, concomitant viral infection, and excessive antibody response to anti-SARS-CoV mRNA vaccine is the cause of post-vaccine myocarditis cases, and it's well published everywhere, so nobody could deny it. And if a government going to go out and say that the booster vaccination doesn't do that, they're lying. It's happening. And this paper that been published in circulation, John, have been withdrawn twice because it have shown the problem about vaccination of myocarditis, and every time comes back with another conclusion until they have make it very clear that yes, other developed post-mRNA vaccine myocarditis advancing insight into potential underlying cause, and it wasn't withdrawn again after being withdrawn twice. The same paper with the same conclusion. Then COVID-19, researchers blow the whistle on data integrity issue in Pfizer vaccination trial, and it is published in the PMJ. The FDA inspection officer noted data integrity and verification portion of the bioresearch monitoring inspection were limited because the study was ongoing and data required for verification and comparison weren't yet available to the investigation new drug. Can you believe that? You go to investigate to see what's happening and you find that there's nothing available to inspect. Director at the Ventava told BMJ that Pfizer falsified data, unblinded patient, employed inadequately trained vaccinators, and was slow to follow up on adverse event reported in the pivotal phase 3 trial. So you have a company that told that they have done a randomized controlled trial and they did not register the adverse event. And it's already published. I'm not getting you something from a journal. It's published in the BMJ over there. Staff who conducted quality control checks were overwhelmed by the volume of problems reported. Can you believe this? So they tell you it's safe. At the same time, people who go on, it's like Boeing having a door falling out or an engine falling out of the wings, and there's a whistleblower. Here is a whistleblower from Pfizer itself. And this was the greatest joke ever. US FDA, CDS see early signal of possible Pfizer bivalent COVID shot linked to stroke. Came in, so they went on to see exactly where it happened and how it happened. And they discovered something completely different. Cleveland Clinic reported an unexpected trend where risk of COVID-19 infection increases with the number of vaccine doses received. So the more you take a booster vaccination, the more likely you get more COVID infection. Remember, you are taking the booster vaccination to prevent you from having reinfection or severe form of a COVID-19. And what they find that the more you take a booster, the more you get COVID-19 infection, the more you get sicker, raising question about safety and effectiveness of the mRNA vaccine in preventing infection. Moreover, it decreasing you the long-term efficacy of any virus in your body, because later on we find that this patient who had more than 3 boosters having higher incidence of shingles, and currently there is a query about the measles outbreak because of the cross-link between it and the spike protein, something we never knew about it. Study labeled mRNA failed experiment. Researcher clarified that primary aim was not to determine the vaccine efficacy. Can you believe that? This is Cleveland Clinic. They tell you that the primary aim of our study was not to determine the vaccine efficacy, but to investigate potential immunological mechanisms that might result in reduced protection from prior vaccine doses. So they were looking for something, and they find something completely different, apart from the stroke that I'm going to show you later on.
Yeah.
Now, serious adverse event of special interest following mRNA vaccine randomized controlled trial in adults. And this was published in Vaccine. It's one of the strongest journal about that. A major conflict of interest within vaccine approval and safety surveillance process, as same official responsible for approving the vaccine are also tasked with monitoring safety, potentially compromising impartiality and transparency. So you are the judge and the executor. Need for a separate agency dedicated solely to vaccine safety surveillance to ensure unbiased reporting and investigation of serious safety signals, advocating for a reform in current system to enhance public trust and safety. And I'm going to talk about that in details later on. Concerns about excess mortality rate worldwide prompt call for urgent investigation into underlying causes, especially in the context of widespread vaccination. Studies and data suggesting adverse events associated with mRNA vaccine, including sudden cardiac death and pulmonary embolism. I have a lot of my patients. I reported that to the Irish Medicine Board, and they came back. It is within the acceptable number, and we left it at that. Now, this is a very important paper, COVID-19 vaccination booster for young adults, a risk-benefit assessment and ethical analysis of mandate policies at universities. So this was done to see what's going on, and was published in the BMJ. So they were commenting also on the Lancet study. The Lancet study underscored concern about waning immunity post-booster shots. So the minute you take more boosters, your immunity are decreasing, exacerbated by factors like N1 methylpseudouridine, spike protein, and antibody-dependent enhancement. This issue could contribute to the clinical alteration and potential link of COVID-19 vaccination to conditions like shingles. And now there's a big hoo-hoo in the scientific arena about why a lot of old people develop a lot of shingles. It's like an outbreak, never happened before. You know, when you are small you get chickenpox, when you're old you get shingles, but it's rare. Now everybody you phone who have got multiple different vaccines, so they got, say, Pfizer, and then Moderna, and then AstraZeneca, and then Johnson & Johnson, and then the Chinese, suddenly there's the following, they have shingles, which is because of the heterologous nature of this different vaccine have affected their immunity. Moreover, post-vaccination complications, including vaccine-induced immunothrombotic thrombocytopenia, which happened to a lot of my patients, have emerged, challenging traditional medical algorithm and patient safety, which you give the vaccine to the patient, they develop acute thrombosis immediately, or they get stroke, or they thrombose their graft, or their AV fistula. I reported that to the Irish Medical Board also. Then the ethical debate surrounding university booster mandate. So, if you are in university, you must take the vaccination. Otherwise, you cannot be on the campus. Remember, this is after the lockdown and the relaxation of what's happening. On transport risk-benefit analysis, recognizing potential individual harm, lack of significant public health benefit. They found zero public health benefit. Inadequate compensation for vaccine-related harm. So if you get a problem from the vaccination, you cannot even get compensation, and broader societal implication. In front of you, you could see the red graph, and this red graph is a complication post the mRNA vaccination, and the green one is the complication post-COVID for unvaccinated people. And it speaks to itself for the numbers. It speaks for itself. I cannot color it more than that. Transparency in policy making is crucial to navigate the trust paradox and maintain public confidence despite short-term vaccination concern. Discovery of rare but serious side effects like acute disseminated encephalitis, which had major problem over the past 18 months, and transverse myelitis, which people coming in with something like Guillain-Barré syndrome, they can't move their hands, they can't move their legs, they're just wobbly all over the place, or people, young girls coming in with spots, or stuff that we never seen before in huge amount. The need for continuous monitoring and swift action to ensure vaccine safety amidst evolving data. Then, waning immunity and side effect. Again, we said that we have taken this in order to prevent any problem with immunity. Impact on post-operative complication. Believe it or not, in Japan they looked at all the complications post-operative. They found the people who had the vaccination and one booster vaccination have 6-fold increase of complication rather than people who were in vaccination. Report from the Department of Cardiovascular Surgery in Japan highlight a concerning rise in post-operative infection, particularly among patients who have received COVID-19 vaccination and boosters. These cases marked by difficulty in infection control and signs of immunocompromise underscore the need for heightened vigilance and potential reconsideration of vaccination strategy among certain population and certain part of Japan, and you know how the Japanese are very, very obedient people. Don't take the vaccine. Now, the ethical consideration, which is one of the most important part, and I know that a lot of people got suspended and because of this ethical one from the GMC, but let's be clear in here. Importance of transparent risk-benefit analysis. If you sit with me and tell me that the policy making is crucial for maintaining public trust, I agree, when they are trustworthy. Even when facing the trust paradox where disclosing negative vaccine information may initially reduce vaccination uptake. Just say the truth and you will win. You cannot keep hiding that we never see complication from the vaccine. If you drink water in Galway, you have complication from it. So there's nothing called zero complication. But if you are open, you tell them the truth, people will trust you. And you know what happened during the lockdown? A lot of politicians used to go for nightclubs or having parties in their offices, which was crazy. Potential for net individual harm. Blanket mandate overlook critical data such as the benefit of prior infection and emerging evidence of adverse effect. So if somebody got the 2 COVID vaccinations, the original one, and then developed COVID, you cannot treat him and tell him that he has to go take a booster vaccination. You need to measure the antibodies and see the spike protein in his blood, because if you give him the booster vaccination and he's just post-COVID, he'll get a cytokine storm and he will end in a bad place. And what we're trying to tell you is that just triage the patient. Look who can take and benefit from it and who can't, because we don't know. And emerging evidence of adverse effect potentially leading to unintended harm. Lack of proportional public health benefit without significant benefit to public health mandate may infringe upon individual liberties. Compensation for harm is very important. The absence of adequate compensation mechanism for vaccine-related harm raises concern about fairness and accountability. And wider social harm is becoming very clear. In Sweden, they avoided that. But I tell you, in places where the lockdown was severe, it's very bad. Wider social harm mandates exacerbation existing social inequalities and undermine trust in public health institutions if not implemented transparently and equitably. Now the side effect, we talk about the acute disseminated encephalitis, the transverse myelitis, the importance of continuous monitoring, and we have to understand that we are facing stuff that we don't know. Despite effort to control the spread, COVID-19 booster vaccination have resulted in adverse effect for some individuals who previously had original 2 doses and suffered COVID infection, leading to complications like stroke, heart attack, lymph loss, and bowel ischemia. I have all this in my publication. Failure of COVID-19 management has led to resignation of numerous chief medical officers, at least in Ireland, highlighting extent of crisis and dissatisfaction with government responses. So, Telegram to Murphy's Law, I published my 3 publications about COVID-19 and the booster vaccination, And you know, John, what's going to happen? A lot of people attack you because you're anti-vax, which I'm not, by the way, at all. In fact, I am for it if it's been done right. Utilizing artificial intelligence and machine learning in analyzing big data provide valuable insight into management of COVID-19, allowing for development of more effective treatment strategy. I published that after showing all the complications that happened to my patient. Bioinformatics modeling supported by AI and big data analysis complement traditional clinical trial by providing real-time adapted approach to patient care and treatment optimization. And I've told them what's wrong, what's right. I definitely was attacked because a lot of people have taken a lot of money from multinational selling tablets. Believe it, the tablets was designed to treat lice in the head. Tablets was designed to treat malaria, have nothing to do with viruses, have been billions and billions been sold without any scientific evidence. Collaborative efforts on an international scale are essential for maximizing learning and adapting healthcare delivery to provide best possible care for COVID-19 patients. Now, this is another fantastic study to show you exactly what's going on. Erosion of trust in government institutions due to perceived cover-ups and influence by multinational lobbies is a significant concern, particularly in the context of public health decisions such as COVID-19 booster vaccination. And the amount of money that have been spent by the multinational to maintain some government to buy more is crazy. Now, this is very important to see what's happened in Australia. In Australia, they were very, I respect these guys for sure. So myocarditis, just to explain to people what myocarditis is, an inflammation of the heart muscle has been identified as a rare but serious side effect following vaccination with the AstraZeneca vaccine. In Australia, post-vaccination surveillance data has revealed cases of myocarditis among individuals who received the AstraZeneca vaccine from further investigation and monitoring. They did not shy, they didn't say it never happened. While myocarditis following vaccination is rare, it occurs underscore the importance of robust post-marketing surveillance. Authorities in Australia have acknowledged these cases and have taken steps to inform healthcare provider and the public about the potential risk associated with AstraZeneca. Do you think this has happened in the UK or Ireland? No. They said it never happened, or it happened 1 in 10 million. It's just crazy, emphasizing the importance of early recognition and management of myocarditis symptoms. Then stroke, again. AstraZeneca. By the way, there was raw AstraZeneca in Ireland after being given to some hospital, unfortunately. A stroke, a serious neurological event resulting from disrupted blood supply to the brain. Cases of cerebral venous sinus thrombosis, a type of blood clot in the brain, have been identified in individuals who received AstraZeneca, particularly among younger age group, mostly female. Occurrence of this cerebral venous sinus thrombosis following vaccination has raised concern about safety profile of the AstraZeneca and has led to increased scrutiny and surveillance of potential thrombotic events post-vaccination. Health authorities in Australia have responded to the report and they have done a task force to look at it. So they did not say it never happened. They did not say we never heard about it. And what happened? They withdrew AstraZeneca out of the market. So conclusion, this example highlights the importance of transparent communication, robust surveillance system, and proactive management of potential vaccine-related adverse events to maintain public trust in vaccination program. Acknowledging and addressing rare but serious side effects promptly, health authority can demonstrate their commitment to ensuring safety and efficacy of COVID-19 vaccination, which up to this moment, they're just rubbishing everything as if they are the gods and they cannot be argued with, thereby mitigating concern and fostering confidence in vaccination effort. Implication of booster COVID-19 vaccination extend beyond immediate immunological consideration to encompass broader ethical, societal, and safety concern with transparent communication and continuous monitoring. A nuanced understanding of risk and benefit are essential to navigating this complexity effectively. So, this guy have put a comment in Virology about the publication that happened recently regarding the Lancet. And basically, if you could see in conclusion, COVID vaccination is a major factor for infection in critical ill patient, and he demanded the suspension of any booster vaccination in the whole world. Virology journal is one of the biggest journals for COVID-19. Now, I will not talk about long COVID because it's not the day today, but I'll happy if we have time to go more to talk about long COVID and what to do with long COVID.